Welcome to another edition of ASI Engage. I'm your host, Kevin van Rensburg. In September this year, medical schemes in South Africa announced their 2022 contribution and benefit rates. After announcing these rates, medical schemes always provide members with a window period that allows them to upgrade their medical schemes or plan without having to wait until the next year. The window period could not be more important at a time such as this, as the country fights the COVID-19 pandemic and the general rising cost in healthcare. Throughout September, ASI's consulting team analyzed the changes that medical schemes have introduced for 2022 and put together a summary of these findings. Joining me in conversation today are Justine Kukamur and Fikile Kumalo, consulting managers at ASI, to further elaborate on these findings. Fikile, as a consulting manager, you have a close relationship with clients and their needs. What has the client's healthcare landscape been like this year?
Thanks, Kevin. This year, like the last, has undoubtedly been one of the most challenging in all economic sectors, most notably in the healthcare sector. What myself and Justine saw in this period while interacting with members is their even keener interest in what exactly they're covered for and what limitations they have on their plans. Now more than ever, members want to ensure that they're not caught off guard in case of a medical emergency, and in turn, the medical schemes have had to adapt. Justine, if you can please elaborate on that.
Thanks, Fikile. Yes, COVID-19 has put tremendous pressure on both the member and employer. So when the medical schemes announced their 2022 contributions in September and October, it was clear to us that any increase or decrease would have this pressure of the pandemic as well as the high cost of private healthcare in mind.
What are some of the trends you saw this year in the 2022 medical scheme changes?
For starters, we saw some medical schemes implement a 0% contribution increase for 2022. But we need to understand that medical scheme contribution increases are based on the economic climate and the performance of the medical scheme of the previous year, so 2020 in this case. We did see some medical schemes, however, implement a lower contribution increase, and this was based on taking the member into consideration, as members have really seen the financial impact of this pandemic. But the general observation was that some medical schemes actually implemented a lower contribution increase, and this was taking into consideration the member and this financial pressure that they've been under due to the pandemic.
I definitely agree with Justine's view. Some medical schemes decreased their contribution for 2022, while others did not even apply a contribution increase. This was influenced by aspects such as a healthy claims ratio for 2020, which resulted in their reserves being at a surplus. So remember, Kevin, the medical schemes need to keep about 25% in reserves for medical emergencies, and the state of their reserves actually assist them in informing what their plans for next year will be.
Fikile, based on that, what we can gather is that medical schemes have worked hard to give members that extra cost savings in various ways. A number of them have opted for contribution freezes until a certain point in 2022. Some have opted for a later increase in contributions, and for a select few schemes, 0% contribution increases for 2022.
Exactly, Kevin.
Aside from contribution cost, COVID-19 has affected most financially, but it's also taken a serious toll on mental wellness. It's therefore been good to see some medical schemes highlight their mental health and wellness benefits.
100%, Kevin. The truth of the matter is that utilization for mental health and wellness benefits has increased since 2020 when the pandemic started. And we've observed that some medical schemes have been more candid about this benefit with their 2022 announcements. The loss of loved ones, of jobs, of prospects have put people under tremendous pressure, and they desperately need these services.
I echo Justine's sentiments. Mental health wellness should be something that any individual or a business looking into choosing a medical scheme needs to list as part of their selection criteria. People are under a lot of pressure. This is regardless of it being influenced by the COVID-19 pandemic or not, and should have access to these crucial services.
Absolutely, Fikile. What was also a common factor in terms of an increase in benefits was palliative care. Tell us more about that.
Some medical schemes have indeed increased their palliative care benefits, and one reason for this could be the fact that COVID-19 made it extremely difficult to have easy access to loved ones who were hospitalized for serious, advanced life or limiting health condition. And this is whether the patient in question had COVID-19 or not. Additionally, hospitals and medical facilities were at full capacity due to COVID-19 cases. So space to provide beds for other illnesses became a challenge. Palliative care benefits are therefore very important, especially if they can be done at home. This is because there's nothing more difficult than not being able to care for a loved one at home and make them comfortable as they are suffering, and also not being able to say goodbye to them in person if their palliative care is in hospital.
Speaking of in-hospital care, one of the biggest challenges that members face is when there is an unexpected shortfall after an in-hospital specialist procedure. This was a common experience for patients who developed COVID-19 related illnesses that needed hospitalization.
That's correct, Kevin. The truth of the matter is that medical schemes do not cover you in full when it comes to hospitalization or specialist procedures. However, there is a solution, a gap cover plan. The SAFA plan covers the payment shortfall associated with in-hospital procedures. Another benefit of having gap cover that many may not be aware of is that if certain medical procedures need a co-payment, this can be claimed back from your gap cover plan. It is, however, important to note that gap cover complements your medical aid plan. This means that gap cover cannot operate in isolation, but in conjunction with an existing medical aid plan.
To add to that, gap cover does make a significant difference when it comes to additional costs for cancer treatment. As you're aware, Kevin, certain medical schemes do have a co-payment when it comes to cancer treatment, and this is where gap cover can make a huge impact.
Having gap cover as part of your current medical scheme plan definitely seems like a cost-effective alternative to a higher medical aid plan.
Absolutely, and based on our findings from this year-end review, what is clear is that members need to consult with an independent advisor like ASI, which is the key in understanding the importance of having an alternative like gap cover together with a medical scheme plan that works with your needs. Advisors have the expertise to break down the technicalities and help you identify your healthcare needs based on the current climate and your life stage. This is why our role at ASI is to provide you with the best healthcare advice to help you manage your risk.
Agreed. Now, based on this year's circumstances and challenges, especially when it comes to the fact that many plans had to be on hold to prioritize the COVID-19 crisis, what predictions do you have for next year, Fikile?
If there's one thing that 2020 and 2021 has taught us, is that there's only so much that you can predict. However, one of the things that we could start to see more of is that we can start returning to a full sense of normalcy. Members will be more willing to have previously planned in-hospital procedures. At the height of the pandemic, this of course was not possible due to overcapacity, the lockdowns, and the general reluctance to be in hospital at that time.
I think it's also important to remember that the financial pressure of the pandemic forced a number of people to give up on medical scheme cover. So adding to what Fikile said, I think we could see that those that had to give up their medical scheme cover sign up for it again, as more people return to the job market and as South Africa starts to open up even more.
Well said. And with that, we are at the end of this episode of ASI Engage. Justine, Fikile, thank you for joining us today. We'd like to encourage you, our viewer, to contact an ASI advisor if you'd like to review your medical scheme plan and find out what option best suits your needs. Remember to follow us on social media for more insights and updates on how we can build wealth and change lives together. Thank you for watching.